publishing, relationship with publishing houses changing. And I'll touch upon a little bit of that as we go through this. Just again, a little bit more about myself and the lens that I see the world through. My family's from West Virginia. My parents were the first non-coal miners to get college educated, and I moved in and out of the state. I've lived all over the country. I lived in the UK for a couple of years. I ended up I actually wanted to go be a general dentist and go out west to a ski town and ski 3 days a week and do dentistry to support my general dentistry to support my ski habit. I ended up in academics. I live in the Southeast. I'm lucky if I get to ski 3 days a year. But I went into public health in Appalachia because I wasn't sure what to do in Southern West Virginia. Developed a passion for children, to treat children and provide care to them. And then I went to UAB and I did a 4-year karyology and genetics graduate program with pediatric dentistry. And that really began to shape my early career. And I've been in academics ever since. And it's been very rewarding. I still see patients. I'm in clinic about 3 to 4 days a week, depending on the week and whether I'm in the operating room or not. So I very much see the world through a science, but also a clinical lens. That's the framework. I had no idea in my wildest dreams that I would ever be an editor of any journal, much less for JADA, and COVID probably helped frame that a little bit. Sitting at home and wondering what I was going to do when the clinics were shut down, and it seemed like a great opportunity to expand my mind, stay in science, stay on the edge of getting to be frontline reading of all the articles that are coming in. And I do like to read, and I like science, and I like information. So I've only been doing it for coming up on 3 months, so I'm a novice at managing this, but it's been fun and entertaining. So that's where I'm coming from. There's a lot of, journals are about information transfer, and that's what we do. So for me, again, as an educator, this is like the ultimate forum to be able to provide information and transfer information and help inform dentists about and oral healthcare providers about doing the very best they can and what's the science behind it. I'll talk a little bit about numbers of journals, electronic forums, things that are going on. Open access is definitely changing the way that the world of journals is moving. And I'll talk a little bit about JADA Open related to that, which is the new journal that's going to be the new ADA Open Access Journal. And I'll talk a little bit about my vision and where I see changes being made with JADA and what we'd like to do with the journal. So, the whole idea of where we get information, and this was alluded to by Dr. Curtis, is some of these things are very passive, but there's a generation out there, and they did surveys related to readership of JADA and where they liked and how they like to get their information. Younger generations like to get it on a phone. They like to get it on an app, and that does change the way that you can format how much information. They want it fast and they want it quick. There's also all kinds of blogs and forums out there where people get information, and it's interesting to see my residents, for example, they're getting information off of the IPEDO website, and they're asking me about the information. And anybody can put anything up on these that they want to, pretty much. I mean, there's some restrictions, but how the fidelity of the information, whether it's factual, has it been vetted, it's not peer reviewed. For the most part. So it's a different world in the way that we're transferring information, and the written print of journals, which is still very much with us, and I hope it stays with us. I like to pick up an actual hard copy journal and read it as opposed to reading on electronic media, which I do as well. But it's a different world out there, and it is transitioning, and it'll be interesting to see over the next decade how things move forward. But it's very different today than it was 20 years ago. Didn't have a smartphone. So the number of journals, the volume, I think they say that I don't remember the periodicity of this, but in a fairly short time span, the amount of information and knowledge in the world will double. And it's fairly quick. And I don't know where we are with that now because it's been increasing over the years. But the number of dental journals out there doubled between 2005 and 2012, the ones that had impact factors and were cited. Michael Glick wrote an editorial about this, and there's a program called WorldCat that's a database of library catalogs. And he said there were over 6,000 dental journals published in 2014, 87 of which had impact factors. That's a lot of journals. It's a lot of stuff to scan. And some of them are, we've got most states will have some kind of publication, if not several different publications, newsletters, journals. Some of the size and the volume of those, the amount of material that gets put out to the readership is quite variable. But if you look at this globally, there literally are thousands of things that dental related journals that are out there. And I actually like to read beyond dentistry. So I'm also looking at a lot of other different kinds of publications to keep my finger on the pulse of, like I have a subscription to Science and American Scientist and other kinds of things. So just spending the time to read all this is interesting, but the access to information is just mind boggling. And a lot of it's online, not all of it's online, but a lot of it is. So it's a different world. Predatory journals. So this popped up. This is an online thing, and with the numbers of all these journals, you've got journals that'll very much go at people to be on their editorial boards. They'll solicit you for publications. They will solicit you for conferences. A lot of these are they're for-profit kind of journals. They have different levels of peer review and expectations of science. So this was the British Dental Journal is not a predatory journal. This is an article related to predatory journals and beware. So this is an ongoing and has been a growing problem. I got this today, actually, and I'm sure you folks get these kind of things, but this is, I don't know what they think I know about statistics and accounting and management, but I can assure you it's very little. But they're asking me to help fill this shortfall, which this looks like, given its volume 2, I'm guessing this may be a fairly new one of these journals that's come up. But I've been invited to editorial boards. In fact, some people said you're probably on editorial boards, you don't even know it because they want names on there for recognition. But this is one where they invited me to the conference, and I don't know what they think I know about orthopedics, but I'm not an orthopedist. I'm a pediatric dentist. But so you get all this kind of stuff out there. So again, they're looking for people, and they're literally predator. They're out there predatorizing folks, or whatever the word would be. They're hunting you down to try and get you to submit an article, or to be on their editorial board, or to pay to attend the conference. I like to send them back and say, yeah, I'd be happy to attend. My honorarium is $12,000. I only fly first class. Yeah, go ahead, send it. And I usually get, well, we might be able to reduce your registration fee. I'm like, delete. But anyway, this is a growing and ongoing problem, and part of it's the whole internet access and the growing amount of information that's out there. So, this a lot of people might have thought fake news came about in the last the administration. Is my reading, what I've read about this. This actually started with Charles Lindbergh back in the day. This was not a new concept, but it certainly took on new meaning, and it became more of an issue. And I think for me, it was really the fidelity of information and how do you trust that information, all the different sources. Dr. Curtis talked about that, and not everybody may agree with what you agree with. And it was quite clear, and it is quite clear, that people they think they're getting their information from very different sources. That you can do that because there are all kinds of sources. So you may believe that the fidelity of your information and then your trust for that is really great, whereas other people have a completely different source and they don't believe it. It's part of our the issues with information and what we trust and don't trust with in the United States and across the world. Actually, it's not unique to the United States, but it's interesting. It's true with science very much, and how much you believe the science. This was a survey from Pew Research in a recent publication, and there have been several of these kinds of studies done. And this is just one table I pulled out, really, just to say it's showing whether they trust them or don't trust them. So the first one up there, medical doctors care about people's best interest. 57% of the people believe that's true. When they say about medical researchers, it's almost half that. It's 35%, which you would hope that the medical researchers are helping inform doctors to take the best care of people. But again, the trust that people put in this now, and I don't have it in this table, but when you get down to journalists and politicians, that trust level drops off precipitously. And the amount of the trust that people put in information that they have in science varies between different segments of the population. So it's a big issue about trying to present information and make sure that it is the very highest quality, the best fidelity, as close to truth as we can possibly get it, which is one of the tenets for the association, for the Dental Editors Association, which I was pleased to see in your, was right top of your web page. So, but this is it's an interesting issue, and I'm not sure how this will evolve, but my guess is that it will not become less complex. You may notice that the clinical scans in JADA have disappeared, and one of the reasons for that is there's a new forum for providing this. The scans that were done were essentially done by a couple of section editors, and Elsevier's provided another way to get this kind of information that's scanned by experts in the field in all kinds of topics. They were doing it in medicine. So if you're an ADA member, you have access to practice updates. And you can tag it so that it'll actually pop up. It'll give you the most hit articles, recent things. You can select your topical areas of interest. So for a quick scan, if you're interested, so I have pediatrics medicine, pediatric dentistry, a variety of things in medicine and dentistry that I'm interested in scanning, genetics, dermatology, different things I'm interested in. So if you haven't seen this, this basically replaces the clinical scans section that was in there, and it's much broader in scope, and it's pretty versatile, and it's actually it's curated by experts in the field. So if it's an oral pathology article, they're developed, these synopses are developed by people that are experts in the field, but you might want to check that out. If you look at how things are changing as far as publications, this is looking at the global public science publications around the world. The United States is this right here, this kind of greenish, the second. And we've been, we've slowly ticked up, but not a whole lot of change since over the last 20 years. And what you see here is in 2015 that China crossed over and is out now outpacing in China, the scientific publications of the United States. The top one up here is EU, so you've got all the collective that would include all the European countries. So you've got a lot of developed countries with a lot of science investment. So that's why that one is the lead dog. But you can see that some of these, India and some of the others are moving up. And that's true with JADA. We see a lot of submissions coming from South America, China, India. So the numbers in the publications are different, which is a challenge because a lot of people want to see what's going on. I mean, it's a global community out there, but people also want to know what's going on in the United States, and some of the things of interest to the practicing dentist in the United States is not really relevant to what's going on in the rest of the world as far as payer models and some of those kind of issues. So that's a challenge, and that's changing, and that's going to be the way that the world is. And a lot of it's driven by the finances. If you look at the amount of money that China's putting into research and the outcomes of this is just, again, showing the same kind of thing, that articles published in peer-reviewed journals, that China's taken the lead in this and has the global share. And this slide actually is the one that's showing the money. Now, China per capita, because they got a boatload of people, so this is a bubble plot, and United States is this blue one here, and this is China here. And it's a matter of how much money per capita. Well, they got a whole lot of people, but they're putting a whole lot of money in as well. So they're not as far along percent-wise as compared to Denmark or Finland, which put a lot of money in, but don't have a lot of people. So I don't know how this will change over time, but my guess is that the United States, we've kind of floated along fairly steady parallel. And it changes administration to administration, and as the economy changes, this changes. But though that's the driver for a lot of this, if you don't not putting the money into the R&D, the research and development, you don't have the people that are doing the work to publish the papers. So that's a challenge, and it's changing the landscape of publishing. Open access. We had a discussion about this yesterday afternoon with Jack Fairkane, who's the new editor-in-chief for the JADA Open Access, which I'll talk about a little bit more in a second. But This is really a new, not new, this has been around since the late 1990s, early 2000s. And there are multiple facets of this. So there are people that are putting manuscripts up on preprint servers, and this is, so even before it's peer reviewed, they've got it ready and they want to get it out there. And the goal is that get the information out as quickly as you can to people so they have ready access to this kind of stuff. It's kind of like, how long does it take you to get an editorial out there, and is the information still even valid? And with times like COVID, you put a death rate in this week, it's not valid next week. It's rapidly changing. And just tell you, it takes me about 2 months. I think my lead time is 2 months, and I can change it up to the day I have to have it in. So I did one on COVID and vaccines and deaths, but it was 2 months. So the numbers were greatly different at that time, but it didn't change the message per se, but it is an issue. So preprint going up ahead, and then they'll have an accepted manuscript, and then it's part of that journal, and that can be put up as a preprint, as an accepted manuscript, and then the version of record is the final accepted, the one that's actually printed, copyrighted in the journal. And this is different for different journals and how it's moving through. But the whole idea of preprint, especially in science where people are, COVID things, you'll see those go up on preprints quite quickly because they want to get it out there fast. The good thing is that it's out there fast and you may get very valuable information. The bad thing is that it hasn't been peer reviewed and it can be fundamentally flawed. And then there's that trustworthiness and the truth of the data that's within that paper. So it's a bit of a double-edged sword. But that's the way the world is headed. So not as much in dentistry yet, but it is definitely happening even in the dental world. So there's online servers, there's different ones, and they probably have different levels of sophistication and scrutiny with these, although again, they're not peer reviewed as they go up. Once they're posted, they actually have the DOI number, so you can search them, you can track them, you can even cite them if you want. To put them into a manuscript. So again, it's a changing landscape out there. This wasn't really much of an issue just a few years ago, but it is now. So the whole open access issue, the idea of open access is that the journal is not a subscription journal. So if you're full open access, and that's platinum and gold, and there's different levels and they're a little bit confusing, but a full open access means that you've paid to print your manuscript, and that the price on that varies from journal to journal. But once you've paid for it, it's up, and then it goes online the day that it's put out, and it's ready to go. So the article processing charge, you pay for it. Some organizations will pay for that if it's a fully open access journal. If you're not a fully open access journal, they might not pay for it. So the Gates Foundation and the WHO and the Wellcome had said, I think it was Wellcome Burroughs, but another big organization that funds research said, we're not going to pay the processing fee. And they didn't say you couldn't publish in a journal like JADA, but if it's not fully open access, they wouldn't pay for it. So that may limit the people that want to submit to your journal. JADA is a hybrid journal. You can have open access and you can pay for it. If you pay the article processing fee, then it'll be open access. It'll go up online and it's freely accessible to anybody. JADA has made all of their COVID papers open access, just as a public service, which I thought was great. So anyway, that's the way the world is moving. There are lots and lots of fully open access journals out there that have flourished. They've done quite well. They have good impact factors. They have publish a lot of good science. Not so much in dentistry. Most of that is in other realms of science, like all the Frontiers papers. There's a whole bunch of them, and they're open access. Or Science has a science report that's an open access journal. So, but this is the way things are moving, and it's hard. Our discussion yesterday is not clear exactly how this will all play out. There have been governments and their organizations. They want to have everybody have access to the information, and that's the push to do it. But there's real dollar costs with doing publications. It's not a free endeavor. There's work involved in doing this. So I'm not sure how this will evolve, but it is evolving and it is changing for sure. So As a move for this, the American Dental Association thought it would be good to have an fully open access journal. And I snagged this picture off of the internet of this handsome young lad here, Jack Faircane, who's has done a lot of great work in materials. He's a previous president of the American Association for Dental Research, very talented person, and he has accepted the job for editor-in-chief for this. So this will be a full gold version. I don't know whether it's gold or platinum, but it's full open access journal, and they're calling it Foundational Sciences because it's really directed at not so much the clinical sciences, the things that the JADA currently manages, but if you're doing animal studies or you're doing cell studies or you're doing very basic science work, that would be the kind of information that would be published in Foundational Science as opposed to JADA, where we don't publish animal studies and some of those types of topical areas. I'm not sure exact timeline. I don't know that they know for sure, but the hope is that over this next year that this will that'll be up and running and actually start having editions come out. So, and how many and how often will be predicated on the volume of flow. But I know Dr. Faircane's done a lot of work getting this ready, and there's a lot of to start a whole new journal with the quality that they want. It takes a lot of background work to work on this. So stay tuned for that. It's up and coming for the launch date. If you know people who have those kind of studies, I know he's already had one solicitation for a possible publication, but that's what's coming down the pike with JADA Open. So where are we headed with, and what's some of my vision related to the journal? Michael Glick was editor-in-chief for 15 years, the longest standing editor ever for the journal. And it's been around for a long time. And he did a lot, I think, to elevate that journal and really take it to a new place. And the quality of the material that was being published was infinitely better when he left than when he started, I think. And that's the feedback I've heard. And you're never going to have everybody happy with the journal because different people want different things. But you have a very broad audience for this journal. And so you represent all of dentistry, and that makes it a challenge, but it also makes it a fun endeavor to try and do as much as you possibly can for the broader good. So mission and vision, I'll mention this, the depth and breadth of topics that are there, editorial board reviewers and how that's changing, and looking at different media platforms are all things that we've been talking about. The little picture here on the side is an example of a graphics abstract, and we've had some discussions about how that might work to facilitate the transfer of information, the transfer of knowledge, and that's what you're trying to do in an efficient way that's interesting, that's titillating to the readers, so they want more. So there's a variety of things that we're talking about as far as moving forward. There was no mission or vision statement for the journal, and we haven't finalized this, but basically the mission is to improve health by advancing science in clinical dentistry. I mean, where the American Dental Association should be there too. I know they support the practice of dentistry, but ultimately in the sort of altruistic, we're trying to improve health of the people that we serve. And the vision of doing that is you're really advancing dentistry with transformative knowledge. We want to provide the very best knowledge that's going to help them transform practices into providing the very best of care. So that hasn't all been finalized, but once it is, that hopefully will go up on, not hopefully, it will go up on the website and help clarify what we do. If you look at most journals, if you look at like Journal of Medical, American Medical, they've got mission, vision statements that helps define what you are and what you're trying to accomplish. Goals and objectives, we want to publish high quality original work, provide a forum for discussion and debate. That was great. Dr. Curtis is on editorials. That's what editorials hopefully do, is help elevate discussion and stimulate thinking and move people to action. So it provides a forum for doing that. Letters to the editor is a forum for doing that when they have questions about or may take issue with the publication and how it was done or the conclusions that were drawn and how, seeing it through a different lens. So it does do that. Inform practitioners of advances in new technologies and communication platforms. Those are all goals and objectives for the journal. To pull this off for a journal like JADA or for JADA Open, there's a fairly substantial team that pulls this off. There's an ADA team that is multiple people that are working on this, that includes like managing editors, people that are running the business side. I have nothing to do with any of the advertisements. That's a whole different story. I don't get involved in any of that. Not insignificant, because it's financial support. The publishing house has another team, and so we deal with them, and they in the background are dealing with all kinds of issues, logistics related to the software we use for selecting reviewers and editorial managing, and all of that process. So that's the publishing house. Now, I don't know if you knew, I didn't know this till I took over the job, but the ADA, JADA used to be an ADA in-house publication. It was owned, run, and operated by the ADA. And I don't know the exact date, but a few years ago, Elsevier took it over. So that relationship between the ADA and the publishing house is very different. They were the publishing house. Now Elsevier, who's doing these things like the clinical practical updates and those are Elsevier supported efforts as well. So that actually gives us new opportunities to integrate between some of the different platforms, the ADA newsletter, the journal, the morning huddle. We had discussion about this yesterday as to how we can help feed information that may be coming from the journal that's newsworthy or brings forth new technological issues that the practicing dentist would like to be informed about, and use those other forums to cross-fertilize between groups. The associate editors, there are 5, and I'm getting ready to add a 6th, that help cover the different topical domains, because again, JADA's got very broad in scope as far as topical areas. And their job is essentially, the workflow is the manuscripts come in, they're submitted. I look at them, I read them, I decide whether they're a go, no go, and if they're a go, who would be the best person, if not myself, for an associate editor, based on their expertise and their interest, but their interest is expertise. And they provide insight. We have regular meetings, and the editorial board also, we have regular meetings, and they provide insight as to directions that we're moving in. The editorial board provides another layer of expertise to help cover the different domains. And then ultimately there's the reviewers, and there's thousands of those. They're critical because they actually are the ones that are reviewing and making sure that what we're publishing meets the standards, and it's good science, it's appropriately designed, presented, and those kind of things as far as the methodologies. So it's a multi-tiered process, and it's a lot of people and a lot of diversity within that, and expertise and people, even around the world. The reviewers and the editorial board are international. So we get expertise from around the world. We just recently switched to a new electronic managing system, which was a bit of a learning curve for any of you who are reviewers for JADA. You would have been solicited to update your reviewer status and go in and use this new. It wasn't quite as traumatic as switching to a new patient care record. If you guys have been through that, you folks, it wasn't quite that difficult. And I had used this system for another journal, but that's been a transition as well as to how this gets managed. But it's pretty efficient. It's actually pretty interesting when you're trying to select reviewers and look at expertise and your ability to jump between different databases and reviewer expertise and PubMed. It's a pretty sophisticated tool. And this is an Elsevier proprietary editorial managing program. So it'd be different. They had Scholar One. Now it's this. Editorial Manager is the new version. Electronic platforms. The JADA homepage, we're working on updating and revising that for a number of reasons. The instructions to authors needed to be updated, and there's a lot of links that you could use for guidelines for publication. So if somebody's doing a systematic review, or they're doing a clinical trial, or whatever it might be, you can link them to those guidelines. They don't have to reside on your homepage. There are websites for all of that. So we're updating the homepage. We're working on that. They've done podcasts in the past for some of the topical areas. That's something that hasn't been going on much of late, but that's an opportunity for another change along with that. And I already mentioned the graphic abstracts would be another thing that could go on the homepage, where they'll have preprints are uploaded on there. Right now you can go online and see preprints from the April issue that's coming out. So they're already online, some of them, not all of it, but there are parts on there. The morning huddle that is highly hit by clinicians, ADA membership, is another forum where I talked about the cross-fertilization between the newsletter, the huddle, JADA, and I would assume with JADA Open, same thing. Dr. Fricking was on the talk yesterday, and I could envision that collectively we hopefully will cross-fertilize with science and information between these different electronic platforms. So that is a quick summary of things that are changing, things that are moving. And I think I was close to my 40-minute time, pretty good. So yeah, I'm happy to take any questions as well. And I'm gonna stop sharing.